Hey, it's the nursing professor. Let's talk about the down and dirty of GI medications along with the conditions associated with them. So first on the list, let's talk about meds that help with peptic ulcer disease or PUD. And so these are going to be meds that's going to help with all that over secretion of acid. And so we've all had that. You might have eaten something bad and you feel like you want to throw up and you get this like burning sensation and it just tastes like almost like bowel is in your throat. Well, some of our patients actually live with those types of conditions, and so they have to take medications to help with that imbalance of gastric acid that happens. And so that could be caused by a couple of things. H. pylori is one of the examples that could be caused by. And so when we talk about a person suffering from H. pylori, we're talking about someone with an infection that needs to be treated. And so the treatment of H. pylori bacteria is multiple antibiotics, usually 2 to 3, and they're prescribed for about 14 days. Nursing considerations include that we make sure that the person understands to take the full course of antibiotics, even though they might have side effects such as nausea, vomiting, diarrhea, because we know with a bunch of antibiotics, then typically it's going to clear out both good and bad bacteria. And acids are something that people can get over the counter, usually a quick fix, and they will get them. And so most common one we know about is calcium carbonate, which are Tums. All right, so we have to caution a person from not taking those too frequently, because first of all, they might be treating the wrong thing. But secondly, you can only imagine that if you are suppressing acid production, that there's a teeter-totter there that you could end up with alkalosis, because we know normal values for the human body is between 7.35 and 7.45. So that is the place that we want a person to live at. So neither too much acid or too much alkaline. Neither one of those are good. And so again, examples would include calcium carbonate, aluminum hydroxide, and magnesium hydroxide. Now, magnesium hydroxide can result in diarrhea. And so if a person experiences that, then we have to make certain that we're looking at the fluid electrolyte imbalance. Anytime somebody has diarrhea, then that is a consideration, including dehydration, because we know we can lose a lot of fluid with that. All right, so we also have H2 receptor antagonists, and so these would be medications to help suppress some of that GI acid, and examples would be meds that end in DINE, like cimetidine, famotidine, which is probably one of the most common ones that we see. It's also known as Peptic. And so what we need to be aware of is that if a person is really having really bad PUD symptoms or peptic ulcer disease symptoms, then it might be best that they have it in IV form and not keep trying to swallow things like a PO pill. It's also used to treat GERD, and you might have heard of GERD, which is Gastroesophageal reflux disease, which is in that same family of disease processes. All right, so something else that we use to treat GERD in particular are PPIs, and PPIs are protein pump inhibitors, and they end in ZOLE. I can never get the pronunciation right, so don't correct me on that. So that's going to be pantoprazole, lansoprazole, or dexlansoprazole. Those are all medications that are considered PPIs, where they reduce gastric acid secretions. The thing with these drugs is that they should only be used short term, like between 4 to 8 weeks, not longer than that. So nursing considerations would be to make sure we're reminding our patients of that. Some adverse reactions or effects of these drugs can include respiratory infections in particular, and it puts a person at an increased risk for pneumonia. Go figure. Right? Also osteoporosis and fractures. And so for the little ladies that come and they already have osteoporosis, then we want to be very cautious of them because they're already at a high risk for breaking bones. And hypomagnesia. And so with that, that's fairly simple fix by giving people magnesium supplements. All right. So the other thing with PPIs, they interact with many medications, especially things like digoxin, Dilantin, Plavix. And so it's important that the provider knows about medications that this person is on. Another common medication that we use is called sucralfate or carafate. And usually it comes in a thick liquid or it might come in a pill. It's very important that that pill is not crushed, but it can be dissolved in water. Okay. And so what happens is with this drug is that it provides a protective barrier to adhere to ulcers and to protect the person from further injury of that ulcer. So these people know that they have some erosion in their lining, and so to protect that, then the carafate makes this barrier, and so it aids in their digestive process. So nursing considerations we need to look at would include monitoring for constipation, and so we would increase fiber in their diet. Also making sure that we know, again, what meds they're on, because carafate can interact with meds such as digoxin and warfarin. And so we need to be aware of that. If it's taken with an antacid, then they should be taken at least 30 minutes apart, preferably an hour apart. And so with carafate, you want to take that 1 hour before meal so it has time to coat the GI system, and at bedtime. Okay, so those are important nursing considerations. A few more drugs here. Prostaglandin E analog. Most important thing is the category X, meaning that it's never given to a pregnant woman. The example is misoprostol, again, category X. Sometimes this is used for treatment with people who've been on long-term NSAIDs, like people with really bad arthritis, and the NSAIDs were used to control their pain, and they ended up with these gastric ulcers. Important that the drug is taken with meals and at bedtime, similar to the carafate. Other GI disorders include those that many of us experience, which would be your nausea, vomiting, diarrhea, and constipation. With nausea and vomiting, it's important to note this. If a person is nauseous, don't try to give them anything by mouth if there's an alternative available. And so when you think of that, if somebody's already nauseous, ready to vomit, and you keep trying to give them more and more pills, that is not going to solve that problem at all. So that's a first nursing consideration. However, antiemetics are a class of drugs that we can use. Sometimes people suffer from nausea and vomiting as it relates to chemotherapy, and so they are placed on these drugs like glucocorticoids, anticholinergics. An example of an anticholinergic can either be scopolamine, which some people use for motion sickness, especially if they're going to take a cruise, or some people even need it for a car ride. Antihistamines can also be helpful, in benzodiazepines. Now, if you remember from the central nervous system topic that we talked about, benzodiazepines should not be used long term. Be very cautious if a person has nausea related to opioids, because sometimes that's a side effect. Also, constipation associated with opioids. And so being aware of that, you can try to get ahead of it. So moving on to laxatives. Laxatives are not good to take routinely. However, sometimes people have such bad constipation, then they have to. And so examples would be milk of magnesia, senna, different types of enemas to stimulate the bowel. We want to monitor intake and output, make sure that the person's not going from constipation to diarrhea, especially really quickly, because that can result in dehydration. For people who need anti-diarrheas because they are having diarrhea, then we need to be careful to note what's causing that diarrhea. Because if it's related to a toxin, then you want that diarrhea to happen to get rid of the toxin. So for example, if somebody eats something and it's food poisoning, you don't want to stop that. You want that to come out. And so you would therefore encourage that and not give them an anti-diarrhea. But examples of anti-diarrhea medications include diphenhydramine and atropine, which is also known as loperamide. And some of those you can get over the counter now. Be careful with laxatives or anti-diarrheas when you have somebody that has irritable bowel syndrome, because that's a chronic illness that is and should be treated differently. That's not a one-time or one occurrence event that they are actually having. Probiotics, some people swear by them. Those are the, you can take either the supplements, or people get it sometimes in like Activa and those types of yogurts. Vitamin supplements, they should take those with food if they tolerate it better that way. But make sure that a person is not just taking supplements just because they think that that is a replacement for their nutrition, because it never is. So that is the down and dirty of the GI medications. Hopefully you got a little bit of med surge there as well. Bye for now.